Hello, everyone. This is Marcy with Mountain Pacific Quality Health. I think we will go ahead and get started. Welcome to our, I think this is the 11th session of It's Worth a Shot. And today's presentation, we will be reviewing some Q&As that we have received on the updated QSO memos. And also we have a guest speaker, Pam Webb, will be presenting why be an IP at this moment in time. Next slide. So as always, we look for any topics or ideas for these webinars. So if you have anything for us, feel free to drop those in chat. And again, we meet every Wednesday at 2:30 Mountain Time. Next slide, Mary. So we're going to just start out real quick with a question for you all. As we all know, high turnover rates are something that's facing all facilities. And as an infection preventionist or new IP, what tools or resources can Mountain Pacific provide that would help you in your role? So that would be a great help to us if you can also put that in chat. Any ideas for us would be appreciated. Next slide, Mary. So we did have a follow-up Q&A from last week, and I am going to turn it over to Kyla since this was related to Alaska.
Thanks, Marcy. So the question basically was the state of Alaska through their the state supplied vaccine was not currently carrying the new pneumonia vaccines. And so we asked for a clarification from the state of Alaska, and they said that they have formed a clinical pneumococcal work group and that they are going to be making a decision on if they will be adding that to their formulary in the future. So more to come, and if we get updates, we will certainly update the group as we find out more.
Thanks, Kyla. Okay, so as everyone knows, CMS put out some revisions to the QSO 2038 and 2039 on March 10th. And so we are just going to share with you some of the questions that have come across our emails. Next slide. So does the vaccine mandate require staff to be up to date? And again, up to date means receiving that booster. And the vaccine mandate outlined in actually the QSO, the 2209 for Montana, Wyoming, Alaska, and the 2207 for Hawaii refer to completing the vaccination series. So that means one dose of a single dose vaccine or all doses of multiple vaccine series. Next slide. So the next question we have been receiving is in relation to the community transmission rates. So nursing homes are supposed to track positivity rates each week. Is there any information regarding the CDC tracker website not working properly? So just a reminder that the COVID-19 community level recommendations do not apply in healthcare settings, and it says healthcare settings should use those community transmission rates. Next slide. So this information was provided, some of you in Montana who may have seen this before, from Erica Baldry, our state communicable disease epidemiologist. And she had mentioned that, yes, there is a slight delay with the data in the COVID tracker, and that may take up to a week to update, but the data does usually catch up. And she kind of outlines what the units of measurement are to determine that transmission rate. And as you can see, it doesn't take many cases to put folks into that moderate or high designations. And this guidance is also outlined in the QSO 2038 that was revised March 10th, if you refer to page 6. Let's go to the next question, Mary. So do unvaccinated staff need to wear N95s? So this has been a question that has come up quite a bit. And our Wyoming and our Alaska State Survey Agency offices have confirmed that N95 is just one of the recommendations. It's not a requirement. It's very important to make sure that your policy and your procedure manual address this. Now, in Montana, when we did check with our state surveyors, they said that each situation might be different, and they encouraged folks to reach out to them with questions. So I think Jesse's going to put in chat that Montana SSA email address. You could drop them an email and ask them questions at any time. And yes, thanks, Jesse. And as well as our other state survey offices, they are open to questions. I will make note that in Montana, Tina Smith, who is the long-term care supervisor, did indicate that what they're going to be looking for is 2 or more accommodations that will be put in place for those staff that are unvaccinated. So there's this list of accommodations for your unvaccinated folks. And they did say this on a call with us, and I know it was mentioned on one of our infection prevention open office hours this week, that they are going to be, again, looking for 2 or more of those accommodations. And also in chat, if you wouldn't mind sharing, what kind of accommodations are you all using? We'd love to hear from you. So speaking of policies and procedures, can't stress this enough. What do I have to have in mind regarding the vaccine mandate? So policies and procedures, this information is taken right out of that attachment A on the 2209 and 07, is having that process in place for ensuring all staff receive those first and second doses by the dates outlined. Next slide. So, and again, including a process for implementing additional precautions intended to mitigate the transmission of COVID-19 for all staff who are not fully vaccinated. Process for tracking vaccination status as well as booster vaccinations, and make sure you're outlining your exemption process. Next slide. And that also includes your medical exemptions. Just make sure that process is documented in your policies and procedures, as well as for staff whom the vaccination must be temporarily delayed, and also note that what your contingency plans are for staff who are not fully vaccinated. And again, just refer you again to the attachment A for any additional policy or program requirements. Were there any questions? I see Maria notes, and 95 shields cannot take care of immunocompromised people. A couple other comments. And again, those emails are also noted in the chat as well. So any other comments or discussion on that? Thanks, Giselle. Weekly testing in N95s. And weekly testing in K95 use. Thanks, Jennifer. Okay, so these are just some resources that we'll have linked into the slides when you get those presentations for the data tracker and those QSO memos. And thanks, Maria. Yes, testing twice a week until the level drops. All right, thanks so much. All right, now I'm excited to turn it over to, do we have Pam on the call? Are you on, Pam?
audio. I'm on.
Okay, so I'm just going to do a brief intro for you.
Okay.
So excited to have Pam Webb, our rock star infection preventionist here in Montana. Pam is an independent consultant with expertise in infection prevention and quality improvement. She managed the IP program at one of the largest healthcare facilities in Montana for over 23 years. She has infection prevention experience in a variety of settings, including acute care, critical access, long-term care, dialysis, hospice, and home health care. As a consultant, Pam orients new IPs, develops facility infection prevention programs, provides NHS and HAI data training and validation, conducts facility IP program assessments and IP training workshops. Pam is also the co-founder and active member of the APIC Montana chapter, and she has participated in many national and statewide collaborative improvement projects that focus on reducing risk for healthcare-associated infections. And she's presented to many local, state, and national conferences on a variety of infection prevention topics. And I can say this last line in Pam's bio that I can certifiably agree that she has a passion for infection prevention and does enjoy working and mentoring other new IPs. So take it away, Pam. Mary can advance the slides for you if you just tell her when.
Thank you. Just leave it on this slide, Mary, for just a minute. Okay, I'm going to use technology here because I only get 15 minutes. And for those of you who know me, 15 minutes is nothing. So I got to make sure that I stop. So I'm going to start my clock. So Jill asked me to present on this webinar that you all have. And I really wanted to present something that I thought would be timely and just open up some discussion points and kind of think about what we're doing. And I've changed my title like 2 or 3 times, but why be an IP at this moment in time was really inspired and influenced by some of the work that we're doing through our Montana HAI program. The role of the infection preventionist is really key to the organization. It really helps to have administrative support to have a successful program. And I think right now, I think we're all tired and frustrated, and CMS and CDC aren't playing ball together. They're saying 2 different things, and what do we do, and blah, blah, blah. So it's really a hard time right now. Getting a lot of pushback. You all are getting pushback. We're getting pushback as we're being asked to help. And sometimes the answers we have are not the answers that the person asking the question wants. And I think really, I mean, when you really think bottom to the bottom, the root cause, what's really making us feel this way, I think it's because we're not being valued for our knowledge and for our contributions to the organization. What we do is extremely important. We manage a program. We're not just a little person that's fitting into this regulatory role. We manage a program, and what we do matters. How we work in our roles, how we're able to influence others, how we're able to really speak to patient safety and infection prevention is really critical. So, but the thing I'm going to tell you guys, I've been in the field for 30 years, and I've gone through similar episodes. If that's what we want to call this time period of our pandemic over the last 2 years. And all I can say is this too shall pass. It will get better. It's not going to be the same when it's done. We're going to learn different strategies, and we're going to be successful. Next slide, please. So one of the things, why do I want to be an IP? One of the things, I hope that you had the chance to get the competency assessment. Now, this is an older competency assessment developed by APIC. And so what I really wanted you to do, and if you didn't have a time to do it before, go ahead and do it after. But kind of take some time to complete the competency assessment. It's going to show you where your gaps are. It's going to show you where you might need to spend a little more time on your own professional development. You know, again, you're a program manager. You're not a live body filling a position or an FTE. You're not there just because we have to. You're there because we have a job to do, and it's really important. So you can see from my picture, wash your hands, mom says so. I take infection prevention very seriously. I don't necessarily take myself seriously. So I'm also been known as the bug queen, the germinator, Auntie Pam, Pammy, and Hey Red. And I respond to just about anything. So go ahead and go to the next slide. Okay, so this is really important. Our infection preventionist skills and competencies. And I want you to feel valued. I want you to really think about the things that you do for your institution, for your organization, for your long-term care setting, critical access, whomever you work for. There's a lot of knowledge that you have to know. You have to be a subject matter expert on a lot of different things. So let's just talk about it. First of all, we need to know how to develop an infection prevention plan and a risk assessment. Those are two documents that CMS will look at. And it's really not that we have to do them because CMS wants us to. It's really because we've done a good job at looking at our own processes, and we know what we need to work on. So these are the things we're going to work on to prevent or reduce infections. We have an infection plan. This is how we do it here at our facility. So when you're looking at all these skills and competencies, let's just kind of go through them. So surveillance and epidemiologic investigation, you know what that means. You've been working on that for the last couple years. But really, when you think about it, when COVID is no longer the biggest deal in our life, you know, what are the things that you need to survey or keep track of? And why do you do that? Is it because someone told you had to, or is it because you made rounds and you saw 20 opportunities for hand hygiene and only 10 compliance, 10 people did it when they were supposed to? So you're at 50%. That's not so good. So you need to work on that. When you look at data collection and analysis, I mean, you need to know technology. You have to have some information technology expertise. When I first started, I did everything. I had a piece of paper and I did sticks. You know, I counted how many I had, and then I had to recount to make sure that the numbers were correct. But now we have so many different softwares. You've got your, what is it called? DOT therapy for your antibiotic stewardship. You need to know Excel. Hopefully, if you're a bigger facility, you have a software that can help you do some of your surveillance and audits. You know, you have to be able to know what you're looking at. And it's not enough to just say, oh, we've had this many infections this month. It's more, you have to dig deeper. Why did you have those infections? What risks caused or may have played a hand in those infections developing? And what are you going to do about it so that it doesn't happen again? I mean, this is not just we've had this many infections and we're below the national benchmark, or we've only had 3 infections. You know, those 3 infections happened for 3 different people, and it could have had a tremendous adverse outcome for those people. So infections are something that's serious. Microbiology, one of the first things that someone taught me, and one of the best pieces of advice, is follow the bug. So when you look at your culture, what does your culture say? What kind of pathogen is it? And then my favorite reference, ready reference for microbes. I got it through APIC. I look up the bug and it tells me where it lives, what's the transmission, transmission, and how does it cause HAIs? So something that's really important, emerging infectious diseases. Listen, in the 30 years I've been doing this, I've gone through HIV, hepatitis B, hepatitis C, SARS, novel influenzas, and we've had at least one pandemic, hepatitis C, antibiotic resistant organisms, MRSA, VRE, carbapenem resistant bacteria, Ebola, MERS, COVID. Guess what, guys? There's going to be another one. There will be another disease that comes up and is going to cause some sort of endemic or pandemic, and you're going to have to be ready to address that. Infectious disease transmission. You know, how are things passed from person to person? The Control of Communicable Diseases Manual, you can get that through the Association for Public Health, the Public Health Association. That is the Bible. I have that on my phone. You call me, I look up the disease. I sound really smart because I know what I'm talking about, but really I'm reading it out of the book. It is awesome because it also tells you mitigation strategies, prevention strategies, and treatment strategies. And when you're thinking about any sort of infectious disease, whether it's COVID, hepatitis B, MRSA, whatever, the prevention strategy, the book title that I am referencing is The Control of Communicable Diseases Manual. And I think I have it on a slide. I didn't put where you could buy it, but you can go out to the Public Health Association. You are welcome, Danielle. Anyway, back to the bug. Transmission is where you're focusing on prevention of spread from person to person. So one of the things, as you're talking about it, and I don't want to step on anyone's toes, but when you're thinking about someone who is unvaccinated for COVID, one of the reasons that you want them to wear a N95 respirator is it's a higher level of protection for them. So you're actually providing them with, in a safer work environment, you're protecting them from breathing in something that may cause a disease because they were unable to get vaccinated for whatever reason. If it's hepatitis B or hepatitis C or HIV, I mean, the things that we've worked on to prevent transmission in the healthcare setting is needles that are retractable, safety needles, any sort of gadget that can help prevent a needle stick or a sharps injury. That's what you focus on. Infection prevention and mitigation strategies. You just have to know them, and you may not know to have to know them word by word, but where do you go to get your information? They're usually based on evidence-based guidelines. So APIC, the Association for Professionals in Infection Control, the CDC, SHE, which is the physician equivalent of APIC. It's the Society for Healthcare Epidemiology, IDSA, the Infectious Disease Society, ASHRA, which is where you get all of your engineering and facility codes. ACHE is where you get your environmental services stuff. You need to know, you need to look beyond the CDC to get to, but the evidence-based guidelines is what you're looking at. You have to know about environmental care. How did I know when I was an RN graduating from Montana State University, go Bobcats, that I was going to need to know about construction, housekeeping, water management, HVAC, heating, ventilation, air conditioning? You have to know about all of that with infection prevention. And you may not need to know everything inside and out, but you do need to know who you need to go to get some help with learning more about it. Education and research. You're a teacher. You're also a learner. And you have to be up to date on the information. And I always say for competencies, choose the right competency for what you're trying to achieve. If you are trying to develop a competency for knowledge, you develop a test. So they take a test. If you want to develop a competency for a skill, you need to have them do return demonstration and document it. That's what folks are looking for when they come and do your survey. And then why do you have to do audits? Why do I have to go out there and watch people wash their hands or not wash their hands, or put on their PPE appropriate, or use the appropriate PPE for the type of isolation we're using? It's because the audits is what you're doing with audits is you're trying to see if the knowledge and skill that you have trained them on is being sustained, that they're doing it correctly. So that's why you do audits. Management and communication. How do you present yourself in a room? How do people take you? How well are you received? Are you self-aware of how you speak, of how you come into a room. What is it that you feel? And I'm not a touchy-feely person, but I've learned a lot through a leadership coach with management and communication. I used to think that I was very passionate, and I am, about this topic. But part of what I also learned was I was coming across too strong. So, being self-aware, self-reflection, and then also knowing that what you say may not be what is heard. So validate, you have to repeat yourself. You may have to answer the questions in different ways, but communication, it's all about relationships, you guys, with infection prevention, probably with any type of field, but particularly with infection prevention, it's all about the relationships that you build with your administrative team, with the people that you work with the staff, whether it's the secretary in the administration office, or the dietitian, or the person that cooks your food, or the housekeepers. They're my favorite people in the whole facility. You need to be able to develop those relationships, and a lot of that comes through management and communication and your leadership and your program management style. So you have to really work on those relationships. You're not babysitting someone if you're doing audits. You're seeing if you are sustaining that practice. And how about process improvement and implementation science? Oh my gosh, when I was first started 30 years ago, all I had to do was really report how many infections we had, and it was below a national benchmark, so we were good. Well, that's not good enough. What about the person who may have an IV that's left in their arm, and then they're immunocompromised and they subsequently lose their arm because of that infected IV site? What about the person who developed a urinary tract infection? I mean, what's the big deal about a UTI? It would have developed into a bloodstream infection and sepsis, and the person died. These things, what are we doing to improve care for our patients and our residents? And what are we doing to prevent infections from occurring? That's what it's all about. Employee and occupational health. Oh my God, do I still have time? Oh, I've got 1 minute. I'm going to go. Employee and occupational health, you have to work together. Cleaning, sterilization, disinfection, asepsis. That's really important. And you need to know about that. Go to those departments, let them tell you what's going on, learn from them, listen. I don't think I have to go over emergency preparedness and pandemic planning because we've been through that, but it's all pretty important. So next slide. Okay, leadership is being, not just doing. And I've already talked a lot about what's on this slide. You have to be curious. You have to know yourself. You have to be emotionally intelligent. You have to be able to read the room. You have to have compassion for people. You need to know yourself, and you need to know how well your skills are with other people. Conflict management. I don't bring that up because I'm a redhead and the oldest of 4 kids. Conflict management, we do that every day. There is an opportunity with conflict management to listen and hear what the other side wants. And oftentimes you're saying the same thing, but you're saying it 2 different ways. So that's something that you have to think about. Delegation, you do not have to do everything. You do not have to do every hand hygiene observation. Grow your team. People like to be invited. People like to have responsibility, and you cannot do it all. You're just one person. Next slide. My philosophy is plant the seed and it's going to grow. So timing is everything. You may have an idea that you want to work on, but it may not be the time for it. So just plant the seed, go back and water it. And before you know it, what you want to happen will happen. Next slide. These are the resources. The one thing I will tell you, if you are brand new in infection prevention, you need to join APIC. They do have a roadmap for the novice IP, which is exceptional. It's really a great training orientation program. And the other thing that I really want to mention, leadership coach. If you can get an opportunity to have someone coach you on your leadership style, that's great. And I didn't put this, certification. Luz Casito is a go to YouTube CIC epidemiologist. She's a great teacher, free. Patty Montgomery, Puget Sound, also has a study group. And the one thing I wanted to let you guys know, I did get an email from CIVIC, which is the CIC board, and they are looking to develop a CIC certification that's specific to long-term care. So I'm very excited about that. It'll probably take a couple years to develop, but that's something that you'll want to make sure that you're aware of. And next slide. And why do you want to be an IP right now? It is the best job in the world, and it's a lot of fun. This picture was taken at a national conference where we were playing Jeopardy. These folks are also infection preventionists from across the country. We just had a blast. Infection prevention, I was lucky to fall into the position. It became my passion, the thing that I really wanted to do, and I didn't even know I wanted to do it. So thank you for all your time. I think there's contact information if you want to contact me. Marcy can send that out. If you have any questions or if there's anything that we can do for you, especially through the Montana HAI program, just give us a call. We're here to serve. So I didn't do too bad.
Thanks, Pam.
You're welcome.
That's pretty darn good. Cover an IP in 15 minutes. Holy cow. Really appreciate it though. We will put Pam's, actually we'll just maybe put Pam's contact information in her last slide, and the slides and the recording will be sent out to everyone and posted to our website. I just want to say thanks to Sabrina for her suggestion on a quick guide to the new updates and changes in terms of our question that started out the call. And just don't forget to click on that evaluation link in the chat. That helps us out. So everybody have a great rest of your week. Were there any quick questions for Pam before we log off?
Heather Bates, if you need any help, just give me a call. Looks like she's on her 3rd day of the job. Good for you.
Thank you. I appreciate it.
Okay, well, I think that wraps it up, and we will talk to everyone next week. Thanks again, everyone.
Bye-bye.